Hi guys, welcome to the PICC line video that we are making for you today. And one of the reasons we want to do this is because we want to make sure that you've seen the type of chest that we're using and the packets that we're using for this skill. Also, don't forget you'll have your PAG over PICC line dressing chains that you can follow along with. First of all, we have an order, so we have verified that. I have my equipment and my hand wash. I'm going to wash my hands, provide for privacy. Hi, my name is Sarah. I'm here to be your nurse today. We have a dressing change. Have you ever had one of these done before with a CVC? Hopefully they're going to say yes. Then I need to verify it's them. So I'll take my order. What is your name? What is your date of birth? And are we allergic to anything? We've identified our patient. We have confirmed there are no allergies. Next, we want to look at the PICC line itself. Now, we will have these chest models on top of a patient, just like this. And with this, we want to assess the site for any signs of infection. So, is there any drainage? Is there any redness? Is there any swelling? Is there any pain? And make sure that we look at the catheter itself, and we want to make sure that we haven't noticed it transitioning or moving out of the patient in any way. Okay? So the next thing we want to do, after I've touched everything, I'm going to rewash my hands. We're going to open our trays. And the trays are just a piece of plastic that gives you a tub to work from. Again, this is sterile. I'm gonna take my mask out and I'm gonna put it on myself, okay? And for this video, I'm not going to, so you can hear me loud and clear, okay? So again, this would be where we are removing our mask and applies to myself, and we would also want to put a mask on the patient. If there is some reason the patient can't wear a mask because they're short of breath, whatever the instance may be, we would have the patient turn their head away from the catheter, okay? So my mask is on, my patient has their mask on. We are going to now get a pair of clean gloves. So I'm going to wash my hands. And I'm going to get my clean gloves. Once we do that, we are going to carefully remove the oat dressing. Now, one of the things I want to point out in this skill is when we start to clean and reapply dressing, take off a dressing, reapply dressing, sometimes they get a little bit difficult to get off and the plastic starts to degrade and sticks to the mannequin. That's okay, that is normal. In reality, that will not happen. If I have someone with frail skin, I would want to get alcohol and loosen up the sides. So first of all, I'm going to remove the bottom part. Away, and I have a trash can right here under me. And next, I'm going to start to remove or loosen my dressing. And you see, as we're doing this, we don't want to pull the dressing this way because you might accidentally pull out the catheter if they are not sutured in. But we want to go in the direction of insertion, so we're going to go upwards. Again, the whole time we're inspecting the line and the site of insertion. And then we're going to move the bio patch. I'm going to wash my hands. Again, this whole time I'm inspecting for redness, swelling, tenderness. What does it look like at the insertion site? I've now removed my gloves. I've washed my hands. Okay, I'm going to take out my sterile gloves. If these gloves you know do not fit you, then make sure you bring the appropriate size gloves with you. I'm even going to remove my watch for this demonstration. And I ripped my glove. We would need to get a new one, but we're going to keep going. We know these gloves rip real easily. They are a size medium. Okay, get rid of this. Now I'm going to set up my sterile field. In here, you're going to have a drape. With the drape, it is two-sided. Let me see if you can see. This is shiny side. This is dull side. So we know shiny side is down to set up our sterile field. Once I've done this, and maybe I don't like placement, I can touch the inside, sterile to sterile. Remember, we don't want to put anything in that 1-inch border. Next, I'm going to get my ChlorPrep, and don't activate it yet because it will get your field wet. You're going to have one alcohol swab that we need to go ahead and open up. Some people will leave it in the packaging, and that's okay. Some people will take the swab out, set it on top of the packaging. It doesn't need to roll. So if that's a problem for you, then we just want to what? Leave it in our packaging. Okay, so either way, whatever works for you, if you want to mess with that. There is gauze or a 4x4. You will have your dressing. And then you're going to have what's called a bio patch. Okay, this is impregnated to help prevent microorganisms from growing around the insertion site. I like to just go ahead, open mine up, set it on my sterile field, throw away my trash. There are tweezers. Can you use the tweezers? Yes, I don't like them because they're flimsy. Last but not least, in there is also where you can time, date, and initial. We'll use that at the very end. So now for the skill itself. Whichever hand, right or left, that you want to pick up the catheter with is fine. But again, once you commit to holding it, you really need to hold it with that same hand. So I'm going to pick up the catheter with my sterile gauze, and I'm going to clean the chest. To activate this ChlorPrep, you're going to hold it down, squeeze the sides, and squeeze the ChlorPrep down into the sponge. Okay, we're going to vigorously clean at least 3 inches around the insertion site. And remember, these have a lot of buildup from where we've used them that is not going to be there with the patient. And what you'll see is where you're cleaning the skin, it'll start to get a little red because again, you need to clean it well. And what ChlorPrep does, it will start to impregnate the outer layer of the skin to help prevent microbes from getting into the skin and into the insertion site. Now we're going to clean the tubing itself because we know the tubing goes up underneath the dressing. Again, I have it now in this and we need to get rid of that. I always tell students we want to move away from the insertion site. We don't want to clean down, pushing those microbes down towards the site. We want to clean away from it, okay? We kind of do it in quadrants. If you look at your little swab, it kind of has 4 sides. So we want to go down, up, kind of flip, down, up, flip, down, up, flip. So you're going to clean about 4 sides of that tubing, turning your swab each time. And as you pull those out of your packaging, you will be able to see the way that we demonstrate. It looks like there's almost 4 sides to it. Before I set my catheter down, you need to allow the skin to dry. And we are going to put the bio patch on, okay? The bio patch has a sponge on one side, it's blue on the other. Blue to the sky is kind of like their little saying that they used to use. Okay, so you're just gonna open that up and put it around your insertion site. Now we are done with that part of the sterile procedure. We're ready to put on the dressing. I'm gonna set my catheter down, throw my gauze away, and it's time for the dressing. As you can see, this dressing is even slightly different than the dressing I removed originally. So again, your packaging might look slightly different than this one. But again, they all still go on the same. You're going to put your insertion site in the middle. Okay, and then we're going to peel the paper off. And remember, I just cleaned this. It's not had time to dry, so this might be very real for you during your check-off. It's going to have trouble sticking because of the fact that it's still a little wet. Again, in reality, it will not be doing this. Okay, you want to make sure that our dressing is good and secure. The last dressing that we had like a little butterfly that went underneath the tubing. This one does not, but I just wanted to show you that. The last thing that we need to do now that we're done, we are going to clean our hands. We are going to time, date, and initial, okay? If you don't have this, all of the dressings also have one. So if you lose it or drop it on the floor, the dressing also has it. And we would want to time, date, and initial, put this on our dressing. We don't want to put it in the window to obscure the ability to look at the insertion site in the bio patch. Now, we want to wash our hands, clean up our mess, put our patient back in a comfortable position, remove their mask, remove your mask, and then we will document appropriately.